The action planning process is built on 5 phases. These phases are: 1. Understand the situation. 2. Establish objectives and strategies. 3. Develop the plan. 4. Prepare and disseminate the plan. 5. Execute, evaluate, and revise the plan. The Planning P is a useful tool for managing the process of response planning through an operational period. It depicts the process and steps involved in planning for the management of incident response. The stem of the Planning P represents Phase 1, Understand the Situation. Gathering information to understand the situation begins as soon as notification of an incident occurs. After a health department receives notification of an incident, it will assess the incident to answer questions such as: what will field-level responders need in terms of support and coordination from the Health Department's Operations Center, the DOC? Which agency has primary responsibility for managing the incident response? Should the Health Department become involved in the response? If so, in what ways? Are there illnesses or injuries that may adversely affect or have affected the Health Department's functions or operations? Are there measures that need to be taken immediately to prevent further harm? How many people are threatened, affected, exposed, injured, or dead? Are community and responder safety threatened? If so, have the community and responders been informed about steps to take to protect their health? Have medical and healthcare facilities been affected? If so, in what ways? What is the likelihood that events will cascade? Phase 1 is also when initial DOC staffing for ICS general and management positions will be established. After the initial information gathering in Phase 1 is completed, emergency management shifts into a cycle of planning and operations.
All of the plans are in motion.
This cycle consists of phases 2 through 5 in the planning process and is referred to as the operational O of the Planning P. Operational O planning processes are based on ongoing information gathering and are repeated for each operational period. The operational O entails a series of meetings that leads up to executing, assessing, and revising the action plan. The action plan will be discussed in greater detail later. The meetings in the operational O typically include Management and General Staff Meeting. Led by the Planning Section Chief, this meeting is to obtain any updates and discuss any issues that may arise for the current operational period or shift. Operation Tactics Meeting. In this informal meeting, led by the Operations Section Chief, the Planning Section Chief, Safety Officer, and Resource Unit Leader translate objectives into tactics. Then they document their decisions on ICS Form 215, the Operational Planning Worksheet. The Safety Officer also develops a safety plan for the DOC staff using ICS Form 215A. Planning Meeting. Facilitated by the Planning Section Chief, the purpose of this meeting is to review and validate the operational objectives and to resolve any concerns before developing the action plan. Operational Period Briefing. This critical meeting presents the action plan to staff and is facilitated by the Planning Chief. The Operational Period Briefing will be discussed in greater detail later in this module. An action plan provides a blueprint for a well-organized, efficient emergency response. At its most basic level, an action plan answers these 4 questions. What do we need to do? Who is responsible for doing it? How do we communicate with each other? How do we ensure the safety and well-being of DOC staff? Although an action plan can be verbal or written action plans serve as documentation of the incident and the agency's response. In addition, a written action plan can be used for future emergency responses. To answer those 4 questions, at the very least, an action plan will include clear statement of objectives. What do we need to do? Assignment lists. Who will do it? Communications plan. How do we communicate? Safety messages. How do we ensure the safety and well-being of personnel? Most action plans also include a DOC organization chart and a map of the affected and surrounding area. Note: large-scale incidents may require a medical plan. For DOC operations, the medical plan will consist of the safety messages the safety officer develops. The steps for developing an action plan include understanding the situation, setting objectives, identifying strategies for meeting those objectives, developing tactics for executing the best strategies, assigning personnel and resources. Different ICS roles are responsible for addressing each part of the action plan. In broad strokes, the DOC manager sets the objectives, answering the question of what must be done. The objectives will be SMART, that is, specific, measurable, achievable, realistic, and time-bound. The planning section chief and the operations section chief develop assignment lists, answering the question of who is responsible. The logistics section chief procures resources and supplies, such as communications equipment, answering the question of how information will be conveyed within the DOC and to other response agencies. The safety officer develops the safety messages, answering the question of how to ensure the safety and well-being of DOC staff. Using standard ICS forms to develop a written action plan is a wise thing to do. Standardized ICS forms, such as those developed by FEMA, provide a practical outline for meeting objectives and distributing information through an operational period. At a minimum, a health department DOC will typically use the following ICS forms to develop an action plan. ICS Form 202, Incident Objectives. ICS Form 203, Organization Assignment List. ICS Form 204, Assignment List. Please note, although the Incident Briefing Form, ICS 201, is not typically part of an action plan, health departments may want to include them. The ICS 201 form is designed specifically to ensure effective incident briefings. A complete ICS Form 201 provides incident objectives, a place to sketch a map, summary of current actions, organizational framework, resources summary. ICS Form 201 should be used whenever possible because it serves as a written record of the incident at the time of the briefing. In addition to standardized ICS forms, an action plan may include other documents. For example, the action plan for a health department responding to a disease outbreak may include a case definition, questionnaire for interviewing cases and contacts, disease reporting form. The completed action plan should be distributed among the various management and general staff positions. A chart of the ICS forms for developing an action plan is available in the resources section of this module. This chart provides a brief description of each form and indicates the ICS position responsible for preparing it. Copies of FEMA's ICS forms for developing an action plan are also available in the resources section. It is a good idea for anyone who is likely to staff a DOC to become thoroughly familiar with these forms. The operational period briefing is an orientation meeting for supervisory staff who will take the next shift or operational period. The purpose of this meeting is to present and discuss each element of the action plan. The management staff, section chiefs, branch directors, division and group supervisors, unit leaders, team leaders, and others as appropriate attend this meeting. The planning section chief typically facilitates this important meeting. An operational briefing also includes a change in personnel and a transfer of command, with authority for emergency response management, formally changing hands to a new DOC manager. During an operational period briefing, the DOC manager, members of the management and general staff, and the operations staff will review and discuss all aspects of the emergency response management, such as incident history, what has happened, the resources available, any constraints or limitations, the scope of the work ahead. Using the action plan as their guide, in a typical operational briefing, the DOC manager will review the objectives for the operational period. The operations section chief and technical specialists, such as an infectious disease expert, will provide updates on the incident. The operations section chief will go over group assignments. The logistics section chief will discuss the resource order and additional support that may be required to meet safety, communications, medical, and transportation needs. The finance administration chief will provide coding information and identify reimbursement issues. The liaison officer will discuss any issues that affect interagency cooperation. The public information officer will address information regarding the incident for the media. The safety officer will review safety messages. The DOC manager will provide closing remarks. The planning section chief will announce the schedule for the next meetings and briefings and adjourn the briefing.